right, we got Dr. Payal Kohli. She is here to talk more about the new COVID variant called Omicron. We're learning that it has been detected now in at least 5 states, including here in Colorado. Scary. First reaction to this, Doc, what do you think?
Not surprised, not panicked, not scared. We very much expected this to happen because we know that this is how viruses work. They spread. Now, what have we learned about the science of Omicron from what we've seen so far? Well, we've learned that there's community spread, which means you don't actually have to go to a country that has it and contract it from the primary source. It's spreading around in the community based on that person from Minnesota that got it.
Who was never in those other areas. Okay.
That's right. Never traveled and got it. So we know that it's spreading from person to person now. It doesn't just have to be from the primary source. We also know that you can be fully vaccinated and boosted, just like all of us up here are, and still contract Omicron. So you might be saying, well, why should I then bother getting vaccinated or boosted? It's going to keep you out of the hospital. We still think that the vaccines are going to offer that efficacy and they're going to protect you. In fact, that's what we've seen. People aren't getting very sick, and so far it's been mild in the vaccinated people.
Is it vaccine resistant, or we don't know? Sorry to jump in on that.
We don't yet know, Tori, if it's vaccine resistant. So what I like to think about Omicron as having all these mutations, and what mutations are a disguise. So it's a wolf dressed up in sheep's clothing, and it's suddenly got a much better disguise. So our immune system maybe doesn't recognize it quite as well, but it still might be able to recognize it. So we think the vaccines will have some efficacy. But a lot of companies are working on that Omicron-specific vaccine. They said 100 days to get that.
Well, Doc, I always praise you for your honesty on the show, right? So what would you say to viewers? Because information changes day to day. What would you say, because information wasn't the same a year ago as it is today, I don't want to believe in doctors anymore because now they seem to be contradicting themselves. What would you say to viewers like that?
You know, I'm really glad you asked me because I want to be really clear. What I am saying today may very well change. And that's been the biggest lesson to me from the pandemic over the last year and a half, is to be very forthcoming with that. We are watching science evolve on a public theater. We're watching things change. So the advice that I give you today may very well change, but I want you to know that what I'm telling you today is based on the best information that we know out there. It's based on the science. This is a natural thing that happens in science. So I think that it's expected that things are going to change with this brand new virus, and the one thing that I've learned myself is to expect the unexpected.
Well, starting Monday, all international travelers traveling into the U.S. will be required to get tested 24 hours before their flight. So what impact do you think that's going to have?
Well, we shortened it from 3 days to 1 day, so I think that's good. It's less likely to miss something. But I'll be honest, why just international travelers?
Right.
Why not?
If it's here, right?
It's here, and that's exactly right. Somebody could be maybe brought it to us from Minnesota or New York or whatever, because it's here in Colorado. So I think it's going to have a minimal impact, if you want my honest opinion, but it helps. The one question that has come up, though, is the accuracy of the tests, because now we've got a variant that's changed. So our original tests still going to work to pick it up.
That's interesting. I was going to ask you, what about the testing? We don't know how accurate it is with Omicron right now. Am I right?
Well, the question has been raised by the FDA, so they're looking at it right now. So far, based on what the companies are telling us, they're saying that the rapid tests and the PCR tests are still performing very well, and we're not having as many false negatives. But remember, the test picks up pieces of the virus, so if enough pieces of it change, it may stop working as well. So I would like to see more data on that, because we're relying so heavily now with travel, with parties, with all the things we're going to be doing on testing, that if the tests aren't performing well, then that's something we need to update as well.
Where's your concern level, just for people out there? The holidays are among us. Should we start canceling plans? Is it that serious yet?
Not yet. So my brother just had a baby a few weeks ago. Thank you. I'm an auntie, so I have to go meet her, and I'm planning to go meet her in a couple of weeks. She lives in New York. So far I haven't decided to cancel any plans, but I'm going to re-emphasize what I said earlier, which is that this is such a fluid situation that I got a ticket that was cancelable, from United. And so if something changes in a couple of weeks, we may have to pivot. But for now, we can still keep doing what we're doing as long as we're vaccinated and boosted.
We don't like to advertise airlines here. We're against airlines.
He hates airlines. He calls them the unfriendly skies, which they are. Thank you, Doctor. That was a lot of good information. If you have a question you want answered by Dr. Kohli, just go ahead and write us on social media. You can also email info@dailyblastlive.com, and it won't cost your insurance $8 million. We'll be right back. Thank you.